The immune system is a complex network of cells, tissues, and organs that work collaboratively to defend the body against harmful invaders, such as viruses and bacteria. Under normal circumstances, it functions like a well-trained army, identifying and eliminating threats while leaving the body's own cells unharmed. However, in the case of autoimmune diseases, this finely tuned system goes awry. Instead of protecting the body, the immune system mistakenly targets and attacks its own healthy tissues, leading to a range of debilitating conditions. Among these conditions are systemic lupus erythematosus, rheumatoid arthritis, and Crohn's disease, each with its unique manifestations and challenges. Systemic lupus erythematosus, SLE, commonly known as lupus, is a chronic autoimmune disease that can affect multiple organ systems, including the skin, joints, kidneys, and heart. The immune system produces antibodies that mistakenly attack the body's own cells and tissues. This misdirected immune response can cause inflammation and damage in various parts of the body. For instance, in lupus, the immune system may produce antibodies against nuclear components of cells, leading to widespread inflammation and tissue damage. Patients often experience a range of symptoms, including fatigue, joint pain, skin rashes, and even serious complications like kidney failure. The unpredictability of lupus can be particularly distressing. Flares of the disease can occur suddenly and may be triggered by factors such as stress, infections, or sunlight exposure. The immune system's failure to distinguish between self and non-self results in a chronic struggle within the body, making lupus a complex and multifaceted disease. Rheumatoid arthritis, RA, is another autoimmune disorder characterized by chronic inflammation of the joints. In this condition, the immune system attacks the synovium, the lining of the membranes that surround the joints. The inflammation leads to swelling, pain, and eventually joint damage. Unlike osteoarthritis, which is primarily a degenerative condition, RA is an autoimmune response that can affect not only the joints but also other systems in the body, including the cardiovascular system. The immune system in RA produces autoantibodies, such as rheumatoid factor and anti-citrulline protein antibodies, which contribute to the inflammatory process. This sustained inflammation can lead to erosion of bone and cartilage, resulting in deformities and loss of mobility. Furthermore, the systemic nature of rheumatoid arthritis means that individuals may experience fatigue, fever, and malaise, making the condition not just a physical ailment, but also a profound emotional and psychological burden. Crohn's disease, a type of inflammatory bowel disease, IBD, presents a different aspect of autoimmune dysfunction. In Crohn's disease, the immune system attacks the gastrointestinal tract, leading to inflammation that can occur anywhere from the mouth to the anus. This chronic inflammation can cause a variety of symptoms, including abdominal pain, diarrhea, weight loss, and malnutrition. The exact cause of Crohn's disease remains unclear, but it is believed to involve a combination of genetic, environmental, and immunological factors. The immune response in Crohn's disease is characterized by an overactive response to the normal bacteria present in the intestines, resulting in damage to the intestinal lining. This can lead to complications such as fistulas, strictures, and abscess formation. The unpredictable nature of Crohn's disease can significantly impact a person's quality of life, often requiring dietary modifications, medications, and sometimes surgery to manage symptoms and complications. The underlying mechanisms that lead to the development of these autoimmune diseases are still being studied, but several factors contribute to the immune system's malfunction. Genetic predisposition plays a significant role. Individuals with a family history of autoimmune diseases are at a higher risk of developing one themselves. Environmental triggers, such as infections, certain medications, and even dietary factors, can also initiate or exacerbate the autoimmune response. Additionally, hormonal influences are thought to play a role, as many autoimmune diseases are more prevalent in women than men, suggesting a link to hormonal changes. The immune system's attack on the body can be likened to a malfunctioning alarm system. Instead of distinguishing between a true threat and the body's own cells, it becomes overly sensitive and reactive. This miscommunication within the immune system leads to a cascade of inflammatory responses that can have far-reaching consequences. The inflammation caused by autoimmune diseases not only affects the targeted tissues, but can also have systemic effects, contributing to fatigue, malaise, and a general decline in health. Management of autoimmune diseases often involves a multifaceted approach. Treatments may include anti-inflammatory medications, immunosuppressants, and biologics designed to target specific components of the immune response. Lifestyle modifications, such as dietary changes, regular exercise, and stress management, can also play a crucial role in managing symptoms and improving quality of life. For many individuals, living with an autoimmune disease requires a comprehensive understanding of their condition and a proactive approach to health management. Despite the challenges posed by autoimmune diseases, ongoing research continues to provide hope for better treatments and potential cures. Advances in understanding the immune system's complexities, including the role of microbiota and genetic factors, pave the way for more targeted therapies. As scientists unravel the intricate web of interactions within the immune system, the potential for improved outcomes for individuals with systemic lupus erythematosus, rheumatoid arthritis, Crohn's disease, and other autoimmune disorders becomes increasingly tangible. In conclusion, autoimmune diseases represent a significant challenge to both individuals and the healthcare system. The immune system's failure to differentiate between self and non-self leads to a range of chronic conditions that can profoundly impact daily life. Understanding the mechanisms behind these diseases is crucial for developing effective treatments and improving the quality of life for those affected. As research progresses, there is hope that a deeper understanding of the immune system will lead to breakthroughs that not only manage symptoms, but also address the root causes of these complex disorders.